Welcome. In this lecture, I'll talk about the adaptation to high altitude and exercise. So let's first talk about the adaptation to high altitude. So whenever someone is in high altitude situation, the barometric pressure is low, and the low barometric pressure actually results in low amount of oxygen in the inspired air. So the amount of oxygen reaching the alveoli is also reduced. So the alveolar partial pressure of oxygen is decreased, and it will lead to a decreased level of oxygen in the pulmonary capillary blood too. So the partial pressure of oxygen in the arterial blood is also decreased, which is called hypoxemia. And this hypoxemia actually stimulates the peripheral chemoreceptor, leading to increased ventilatory rate, meaning hyperventilation. And if there is hyperventilation, it will lead to increased loss of carbon dioxide from your lungs. And increased loss of carbon dioxide from your lungs will lead to respiratory alkalosis. And this respiratory alkalosis is actually compensated for by kidney. So kidney starts to increase their excretion of bicarbonate. And you can actually augment this process by using acetazolamide. And another important response to hypoxemia is increased production of erythropoietin. And increased production of erythropoietin has multiple effects. So there is increased RBC volume, increased amount of hemoglobin. And hemoglobin is the main determinant of the oxygen carrying capacity of the blood. So there will be increased oxygen carrying capacity, ultimately leading to increased oxygen content of blood. And also there is increase in 2,3-DPG concentrations. 2,3-DPG actually is a substance which reduces the affinity of hemoglobin for oxygen. So the oxygen hemoglobin curve, dissociation curve actually shifts to right, and there is improvement of unloading of oxygen in the tissues. Another important consequence of adaptation to high altitude is pulmonary vasoconstriction. Because there is low amount of oxygen in the alveoli and also in the pulmonary capillaries, it leads to vasoconstriction. And pulmonary vasoconstriction can have detrimental effects on the resistance of the pulmonary vascular system. So there can be increased pulmonary arterial pressure, leading to increased workload for right side of the heart against the higher resistance. And if someone lives in higher peaks for a long time, maybe during their lifetime, it can cause hypertrophy of the right ventricle. And there are some cellular changes that also accompany the adaptation, which is increased mitochondria. Here we have a practice problem. A healthy 34-year-old man travels to Peru to participate in a mountain climbing expedition. During his trip, he stays in a high altitude camp in the mountains at over 400 meters above sea level. After 5 days, he has his blood drawn by the camp's physician. Which of the following arterial blood gas values would be most expected in this sample? So let's solve this question. First of all, this patient is having an adaptation to high altitude, and one of the part of the adaptation is hyperventilation. So this patient will hyperventilate, and this will lead to a high pH or respiratory alkalosis. So in these values, the alkalotic values are the D, E, and F. And next, let's look at the partial pressure of oxygen. As this patient is having hypoxemia, the partial pressure of oxygen might be 60 or maybe 75. Next, let's look at the carbon dioxide level. As this patient is hyperventilating, there will be increased loss of carbon dioxide. So the answer should be D, because in F you have a 50. So the answer is D. And for this decreased carbon dioxide, the plasma bicarbonate is also decreasing as a result of compensation. So now let's talk about the response to exercise. So during exercise, it increases the ventilatory rate to match the increase in oxygen consumption and carbon dioxide production in the body. And the arterial pH does not quite change during mild to moderate respiration exercise. But in case of strenuous exercise like swimming, it can decrease because of lactic acidosis. And in case of exercise, there is actually no change whatsoever in partial pressure of oxygen in the arterial blood and partial pressure of carbon dioxide in the arterial blood. But in venous blood, the carbon dioxide content increase, and the venous blood, there is decrease in oxygen content, because the carbon dioxide is produced by the tissue and oxygen is consumed by the tissue. And pulmonary blood flow is actually increased because the cardiac output also increases. And as the pulmonary blood flow increases, the more pulmonary capillaries are perfused and more gas exchange occurs. And the distribution of the VQ ratios throughout the lung is more even during exercise. and it actually results in decrease in the physiologic depth space. Now we have a practice problem. Increases in heart rate and cardiac output are observed in a 32-year-old woman. Simultaneous arterial blood gas studies show a normal partial pressure of oxygen and a normal partial pressure of carbon dioxide. Those changes are most likely part of an integrated response to which of the following? So I think this will be very easy. So the answer is exercise. During exercise, you have an increase in heart rate, increase in cardiac output, but the partial pressure of oxygen and carbon dioxide in arterial blood remains normal. We have another problem here. A 23-year-old military recruit begins special training that involves high-intensity physical exercise. At the peak of the exercise, which of the following parameters is the same in the systemic and the pulmonary circulations? Pause for a moment. Pick your answer. For my answer will be blood flow per minute, because blood flow per minute is always the same in the pulmonary and the systemic circulations if there is no problem, if the person is actually healthy. Another practice problem. A 23-year-old male runs for 5 miles. And which of the following do you expect to increase at the peak of his exertion? Pause for a moment. Think. Okay. So my answer is carbon dioxide content in the mixed venous blood. Because whenever someone is exercising, their muscles are producing a lot of carbon dioxide. And this carbon dioxide is coming into the venous blood. So the carbon dioxide content in the mixed venous blood will be very high after strenuous exercise. That's all from me today. Thanks all for watching my video.